Hello, we have our guest today. Our guest is Professor Tit Albrecht, who is the head of the Center for Healthcare, National Institute of Public Health of Slovenia. And we will be talking about the initiatives in the area of optimizing oncological care across the Europe and with particular focus on Central Eastern Europe and in particular about Poland. Welcome, Tit.
Yes, happy to be here. Happy to be
Hello.
talking about cancer and Poland.
Yes, Tit, the national strategy for oncology in Poland, considering the circumstances we are now, with the fact that we are just at the beginning of the execution of the national strategy, and at the same time, we are experiencing the need to execute such an important initiative during the epidemic of COVID. What do you think should be the priorities and what should be the focus of people responsible for the quality of care?
Thank you for your question. I think that regardless of the frustration to the people who have prepared the strategy and who would wish to implement it fully immediately, and they are not entirely capable of doing so in view of the epidemic, I think it's nevertheless very important that you have it. Because, of course, hopefully the breakthrough in the management of the pandemic will be the vaccination. And of course, in probably within a year's time, we will be very close to the pre-COVID situation, which means that everything will have to start running actually very rapidly. Cancer was protected in many countries during this pandemic. At least the authorities were trying to cope with the need to not to skip cancer patients, because we know that non-COVID care was affected. And I think that one of the areas that you designed very well and that you focused a lot of attention on is the prevention side. And of course, the prevention side should take place in any case. We had bad experience in Slovenia during the first wave because the screening programs were put on hold, and there was a big backlog of our citizens who, not patients, of course, some yes, but most of them no, who had to go through the screening programs. We managed to catch up on colorectal cancer screening, but still not entirely on breast cancer and cervical cancer. So these delays can be very dreadful. So I think that you should introduce the full-scale screening programs with all the cautiousness and so on. Secondly, the preparatory work for the introduction of some organizational changes that are also envisaged should also proceed. And the third thing that you have clearly outlined in the plan, which is the approach with the multidisciplinary teams introduced at all levels and for all cancers, or to the biggest extent possible, should also proceed, because this is an internal medical, well, not only medical, of course, but it's something that belongs only to healthcare. So I think that let's try to use this unfortunate situation as an opportunity to push. Never, in spite of everything, we need to prevent delays on cancer care.
So, sort of, we are learning how to deal with the subsequent waves of the COVID. Is this, in a way, appropriate also to start thinking about the waves that will come behind the COVID wave? So we expect a wave of screening, the wave of prevention, but maybe also a wave in the treatment, because out of a sudden the patients that might have withdrawn from visiting the doctors or were waiting longer with their symptoms will suddenly pop up in the system, and then the system will have to be able to cope with these waves. Is this something we should consciously address and get prepared for this also in the area of oncology?
I think so, indeed. I think that the reasons why we see a lower number of diagnoses of cancer in this period is not only the result of the fact that the healthcare had to shift a lot of resources towards COVID, but the second reason, a very important reason in many countries, which we see from survey, is that people are simply afraid of entering healthcare because they know that healthcare is potentially also a risk area to contract the COVID. So basically, it's not only the problems that we had before COVID, waiting lists, delays, insufficient coverage of screening programs. All that, of course, is always a problem, a challenge. But now, of course, there is the fear of people, to avoid contact, frequent contacts with the healthcare system in order to avoid getting infected. If you are at home, you can control. If you get into healthcare, you don't know, you might get in touch with people who are infected. And for a cancer patient, this is, of course, a particular challenge, especially for those patients who are already in treatment, especially immunotherapy. And we know that they are frail, they are delicate patients. And so it's not only about the screening side, which, of course, I strongly support. And I think that one other thing that I see as an opportunity for Poland, and I think it was put forward by Professor Wilding from the US today very clearly, of course, addressing the tobacco problem comprehensively as well gives very encouraging results. And this should also be taken care of, especially because we know that people are stressed in these times. Maybe even some former smokers, I hope not, but even some former smokers might consider starting to smoke again. So there will be a lot of additional burden. I think that the fact that you have a clearly prepared strategy, which is elaborated, it addresses the whole trajectory of cancer control, is actually an opportunity for you now to act very quickly.
Thank you. You have this unique perspective of observing the development of different national strategies in oncology. How would you evaluate the Polish plan? Do we have a good plan?
Today there was a discussion about the past in the development of the Polish attempts to produce a national plan, a national strategy. I have to say that I attended a meeting, I think it was about 6 years ago or maybe less, in Warsaw, where I was invited by the Europa Colon Network. And there was a very strong criticism of the former, this forelast, I think, strategy that existed, that it was not really a comprehensive strategy. It was more a sort of an instrument to allocate resources to certain priority fields. And then there were initiatives by the Polish Oncological Society and also other actors to pull the strings together. I think that now you do have a modern document. You have one that you can be proud of because you produced it nationally. Some countries have used extensive support from abroad. In your case, it's I think the capacity, of course, is more than sufficient nationally. But of course, you did have some whispers from the side, very kind ones and very helpful ones. I think that was wise as well. And I think that this approach now provides Poland with a unique opportunity to address the challenges of which exist. Of course, the country is big in terms of, we're talking about European, of course, sizes. It's comparatively big. It's also big in size. So there are some challenges of access in terms of radiotherapy and so on. So you can address the different the different challenges, of course, only through a national cancer strategy or a national cancer plan. I would put it quite highly on the list of European cancer control documents.
Thank you very much, Tit. Our guest today was Professor Tit Albrecht, head of the Center for Healthcare, National Institute of Public Health of Slovenia. Thank you very much, Tit.
Thank you, Łukasz. And